Well, our study is basically a study to look at a new method of delivering propofol without using an anesthesiologist. There's been a lot of interest in developing better sedation methods for GI procedures. Propofol is clearly a superior drug to traditional drugs such as midazolam and fentanyl. However, in the US, most propofol is given by anesthesiologists, which makes it extremely expensive. Previous attempts to use sort of non-anesthesiologist administered propofol have not been successful because of a number of reasons. We have had a lot of experience with so-called computer-assisted propofol sedation, otherwise known as CAPS, and sold under the brand name of Sedasis. So we worked with this company for a long period of time, and we've used CAPS on a very large number of patients, over 15,000, with excellent results. Unfortunately, in 2006, the company that manufactures CAPS went out of business because of financial reasons. Now, the technology worked very well, and so there were no safety or effectiveness concerns, but it was a purely financial issue. So when CAPS was no longer available, we felt it was important to develop a method that was like CAPS, but without the actual Sedasis machine. So what we've termed NAPCIS, which is sort of an acronym for Nurse-Administered Propofol Continuous Infusion Sedation. So NAPCIS is really just using the same dosing protocol as CAPS, but without the actual Sedasis machine. So just very briefly, in our study, we looked at a number of patients, about 490 patients who had undergone routine GI procedures with NAPCIS. We compared them against similar patients who had undergone procedures with CAPS, okay, so Sedasis, as well as another control group of similar patients who had undergone procedures with traditional midazolam and fentanyl. We found that NAPCIS was equally effective compared against these two other methods, but was more efficient in terms of a faster recovery time and a faster procedure time, and extremely safe since there were virtually no serious complications. So these are preliminary results, but we think they're very promising. We've previously published 3 studies on CAPS and have demonstrated that CAPS works very well. And this is really just an attempt to make the dosing protocol of CAPS available, even though the company is now no longer in business. So one thing I do want to point out is that even though NAPCIS has worked very well for our patients, it's not for all patients. In our hospital, we're very careful to select patients who are low risk, relatively healthy, patients who are undergoing relatively simple procedures. I want to emphasize that the anesthesiologist has a unique set of skills and expertise, and for patients who are sicker or for procedures that are more complicated, it's going to be important to still involve the anesthesiologist. So they still have an important role to play in GI procedures. But I think if we were to be able to use NAPCIS for low-risk procedures, that would free up a lot of our anesthesia resources to concentrate on areas where they're truly needed.